Paramedics and practice nurse. And as well, I'm going to meet Robin, who's a pharmacist, Simon, who's a paramedic, and who's joining me as well is the clinical service director, a direct advisor, Mohammed. Hello, Dr. Jonathan.
Hello. Hello.
Thank you for inviting me today.
Thanks for coming all this way.
And it has been a real pleasure to be here today, taking me around to see the university, Plymouth University, and especially your GP practice, which is really, really amazing, the stuff you're doing over here. Can you tell us more about what you're doing in the practice? What about the updates?
Okay, so current new services that we are developing are an urgent care service, which involves a team approach, working with a clinical pharmacist, soon to be recruiting more clinical pharmacists, paramedic, nurse practitioner and duty doctor, which are dealing with the on-the-day demand, so the urgent care demand. The idea of that, the premise behind that is that we hope that they'll be able to take some of the urgent care work away from the other clinicians, so the other nurses and doctors that we employ can provide a better access for continuity of care for long-term conditions and planned care by taking away all the urgent on-the-day demand. And initial indications are that there's a massive amount of the work which has been taken away, and hopefully that will mean we'll be able to increase the capacity for that long-term condition, perhaps with longer appointments, while still meeting those acute needs on the same day. So one of our projects through the Challenge Fund last year was an outreach COPD service, which was led by a healthcare assistant. So we identified one healthcare assistant who managed 600 patients. So those patients got regular phone calls and a named clinician with this lady who helped them understand their illness, helped them understand how to escalate treatment when it's necessary, and help them increase their confidence in managing themselves. So these patients used more rescue packs, had less unplanned admissions, and had really improved confidence in self-management. We also, at the same time, had a service which was an early visiting service from GPs. We managed to get funding again through the Challenge Fund to free GP time early in the day from 8 o'clock in the morning to go out and do visits for our 33,000 patients, for those who needed to be seen and assessed urgently in the day, so that we could get early engagement with community services or ambulatory services to prevent unplanned admissions, but also to get better use of those services. We also found that there's good evidence that an early admission means that people can get those tests done and then get discharged on the same day and have on average shorter stays in hospital.
And what about, how did you find the pharmacists in the GP practice? You have one of the pharmacists, Robin.
Yeah.
How did you find that works within your GP practice?
Oh, it's fantastic. The amount of specialist knowledge that we've all gained from Robin has been great. His manner's been fantastic. The way he fits into the team is fantastic. And so the education, right through from patient advisors through to our nursing team, to the doctors and the doctors in training has been really invaluable. So if we could have had 3 Robins at the time, we would have taken.
So you're looking forward as well to employ more pharmacists?
Absolutely. So next week we're interviewing for more pharmacists through the Clinical Pharmacist and General Practice pilot. And we've also got funding for a care home service, which is pharmacist led as well.
Pharmacists in care homes, yeah.
Great.
Okay. Yeah, thank you very much for today, and I really had learned a lot from you today, and I'm really happy today to be here. Thank you very much.
Thank you for coming.
Thank you. Hi Robin, how are you? It's nice to see you. I'm going all the way from Surrey to here, 200 miles, to see you in the GP practice today. We just would like to know how everything about your background and how you became an IP pharmacist. So just tell us more about you.
Hi, I'm Robin. I'm the practice pharmacist at Beacon Medical Group. I've been with Beacon for about 14 months now. So my background is a community pharmacist. I went to Cardiff University, did my pre-reg with Lloyd's, worked for Co-op Pharmacy for a while, and then thought about really having a change from community pharmacy, and really utilising the skills that pharmacists have in talking to patients about their medicines really, and about minor illness and minor conditions. So kind of took a sideways step for about a year and worked for a company called Interface for a little while, which go around GP practices doing clinical audits and helping practices improve their prescribing and helping with quaff and things like that. And then an opportunity came up with Beacon, so I started working with them in about November 2014, and I guess exploring really what pharmacists can do in general practice. So the practice are a great company to work for, they're very supportive, they're really innovative, so we've got quite a diverse team here now at Beacon with nurse practitioners and paramedic practitioners, and essentially trying to free up some of that workload on GPs for things that each of our unique skills and abilities help to support the GPs and the practice team with. So obviously pharmacists, it's around medicines and minor ailments, so that's where we're at the moment. So here at Beacon we've now got an urgent care team where we're essentially triaging patients on the phone before we essentially assessing them to see if they need to be seen face to face by either one of the members of the team, so a paramedic, a nurse practitioner, or practice pharmacist or a GP, or whether we can advise them to look after themselves at home if they've got a minor condition which they can self-manage, and obviously linking in with the community pharmacies. So locally we've got Pharmacy First services who can help support patients with that. So far it's going really well.
Hello Simon,
Hi.
nice to meet you today. I just came from Surrey to come and see the Beacon Group, and I would like you to introduce you more about yourself. Can you tell us what you do, what stuff you're working on? It would be really interesting, and introduce yourself.
I'm Simon, I'm the advanced paramedic practitioner. I've been working for Beacon for the last 6 months. My role entails dealing with mostly acute cases of children and adults. I also am a resource officer for the group, so I do a lot of the training and teaching for the group and any students. I'm a coordinator for some of the students that come to practice as well. Previously I worked for the ambulance service as an emergency care practitioner, and my roles included providing emergency care but also minor injuries, minor illnesses.
So how did you start your role? I mean,
I had a meeting dealing with a patient in my previous career. I bumped into Jonathan as he was a duty doctor, and we had a look in at various meetings to see if we could introduce my previous role into primary care, and since then it seems to be working well.
Okay, thank you very much. Nice to meet you.
Thank you.
Hi Simon, my name's Mohammed.
Hi Mohammed.
Very nice to meet you. So Simon, it's quite interesting you've got this role in GP practice. Perhaps if you can tell me a bit about your background and how you got here.
Yeah, I worked as an emergency care practitioner for the local ambulance service, and emergency care practitioners, or sometimes called specialist paramedics, basically their role is to do enhanced patient care in order to keep people out of hospital. So as well as the emergency treatment, we also do minor injuries, minor illnesses, and going around to people who may not need acute admissions but may need to be referred on to other services. So we do care plans, end-of-life care, and dealing with other non-acute cases.
So we talked a little bit about prescribing and PGDs, and I think you guys use PGDs in your current role or in your previous role.
Yeah, paramedicine's a relatively new profession. Registration only started in 2000. We are currently unable to prescribe at this day, but the legislation should hopefully be changing soon. We do use PGDs, we do have the ability to use them, and in my previous career we used them extensively in order to deliver patient care, and it's something we're using or looking at using in Beacon at the moment.
So your role within Beacon then, is that similar or dissimilar to your past experiences?
I do home visits, I do a couple of home visits, the same as as any of our GPs would do, but most of the time patients come to me, I triage on the phone, and I bring patients in to the relevant healthcare profession to try and support them.
And do you see this role expanding further in GP practice?
I've had numerous phone calls, emails with various NHS trusts throughout the country, and I'm looking at who are looking at introducing this role, certainly around this area. With many other GP practices seem to be liking how it's working and starting to introduce paramedics in primary care.
Yeah, I think it's fantastic, and wish you all the very best.
Thank you very much.
Thank you very much.
The University of Plymouth for hosting us here today. It's really exciting to see such a mix of here. My name is Claire Oakway and I'm the Chief Operating Officer of Beacon Medical Group. We are a GP practice merger in the area supporting 33,000 patients, and we've had a fascinating